Edgeless Diffractive Optics, Clinical and Optical Correlation by Dr. Prakhyat ROOP.
Very good afternoon to the chairpersons, Dr. Shroff sir, the moderators, the conveners, and all the audiences. I am Dr. Prakhyat ROOP. I'm going to be talking about the edgeless phase matching technology and its clinical and optical correlations. So whenever we are talking about presbyopia correcting IOLs, our top three concerns are the visual side effect profile, the range of vision that we will get, and the quality of distance vision. And the litmus test for all these things is when a patient has a clear lens in one eye and cataract in the other eye. Which lens is your go-to lens? So the answer for me is this lens, which I'm going to be speaking about, sir. So when we talk about trifocal lenses, it gives you excellent spectacle independence because it is based on a diffractive technology. But it also gives you all the side effects that come with a diffractive optics, that is ghosting, halos, night driving problems, and daytime loss of contrast. And if you look at EDOF lenses, it does all these things but lesser. So it will give you spectacle independence but lesser. It will give you nighttime driving problems but minimal. And it will also cause some loss of contrast, but it may be very less. So I got on to actually analyzing why diffractive optics works this way. So in diffractive IOLs, there are vertical edges on which light scatters. And there's actually this patent on cameras, and these lenses were used in cameras initially, which says that if you want to decrease these side effects, then you have to either decrease the step height or you have to mask the vertical edges with a black dye. So basically, the step heights and numbers are the culprit why diffractive optics has the side effects. And this lens, when it came to me, it had 0 steps. That's how it was introduced to me. Edgeless phase matching technology. It's a diffractive, technically it's a diffractive lens, which has a negative kinoform profile. A negative kinoform profile basically means that if this is the base curve and the conventional kinoform profile, that is the second one, is added to it, you will get a trifocal lens or a bifocal lens, just like we discussed just before in the talk. If you match the negative kinoform as well, then you will get a profile which has both negative and positive attached to each other, which gives you what is being called the Lmax profile in this lens. We've analyzed the data for this lens for 500 eyes, out of which 170, that is 340, were binocular. And you can see that in a conventional trifocal lens, you get these rings which reflect in your slit images, but in naturopanfocal lens, you do not get any such reflections, so you don't expect that the patient is seeing ring shadows or ghosting of images. We actually calculated and analyzed our data for visual acuity with naturo binocularly for distance, intermediate, and near. It remains better than 0.1, that is 6 by 7.5 or better. And for distance and intermediate, it is 6.6 or better. Now looking at a monoocular mean visual acuity, because that is something that tells you the performance of the lens as such. The corrected distance visual acuity mean for distance was 0, for intermediate was 0, and for near it was close to 0.1, which is better than N6. If we look at the presbyopia correcting range, that is the reading range, which is from 100 centimeter to 33 centimeters, we can see that it maintains a 6 by 6, that is N4.5, and as you approach closer to 33 centimeter, it comes close to 6 by 7.5, which is still better than N6. We did not have any starburst, waxy vision, photic phenomena, or adverse visual symptoms. Night driving comfort was excellent. And this basically we analyzed by taking a cohort of patients that had a trifocal in one eye and were having visual symptoms that were causing them not to undergo cataract surgery in the other eye. They were hesitant. So 12 of these patients we did. All of them had the problem of severe starbursts. Some had, 4 of them had severe halos, and 5 of them complained of ghosting. And we implanted naturopanfocal in the contralateral eye, and none of the visual symptoms occurred. Now, we've also done one eye monofocal aspheric and another eye naturo in 54 patients, clear lens exchange in 32 eyes of 16 patients, and like sir was talking about, one patient having a eye which is clear lens, young patient with good accommodation, and other eye has a post-traumatic PSC or a steroid-induced cataract or something like that. That is the litmus test, and this is my go-to lens there. Now, the reason it does so well is because it has this LMAX profile, which eliminates all these edges and utilizes the complete surface of the lens to
Prakhyat.
useful focus.
Prakhyat, you have 30 seconds more.
Yes, sir. It also has what is called pupil independence, which was awarded at the ASCRS for its concept of distributing the light in such a way that you use the physiological pupil aperture to actually modulate the distribution of light between the different distance and near focuses. And because of eliminating these edges, you get this jump in the defocus MTFs compared to a standard trifocal lens. This lens is currently now being available in hydrophobic material. In my experience, it delivers excellent natural quality of vision with reduced chair time, no bother with ring shadows, excellent night driving vision, true spectacle freedom, and is quite forgiving in even amblyopic eyes. Thank you.
Thank you, Dr. Prakhyat. Just before moving on to the chairperson, all your slide were showing the study initiated in 2020. So is it a published data you were discussing, or this study is still ongoing?
No, sir. My data is published. I mean, it's unpublished, but it's completed. The study was completed in, I think, 17 or 18 months. But then the data is with the company, and they are doing more studies. One study was done at RP Center, as you may be aware, and a few other sites. So they are collecting all that data, and then it will be a study that they will publish.
Comments from our chairperson, co-chairperson?
Sir, it was available in the hydrophilic material when we did the study. So now it is available in the hydrophobic and toric platforms. It is being launched at APAO.
Which company is this?
Care Group.
Care Group.
Care Group.
Made in India.
Made in India, sir. They had some associations with Spain, University of Valencia in Spain, where they did the diffractive optics, and all these optics was designed, and it's being manufactured in the same facility as the other lenses, IPCL and all.
Because it seems to be extremely promising lens, because with no glare, no halos,
Yeah.
excellent near
No,
vision, excellent
halos are always there, sir.
excellent,
But I
excellent
think,
distant vision. It promises to be
Yeah, ideal
a
lens.
very,
The
very.
study need to be published first.
I
then
don't know,
only.
because I have started my career in 1978, and I was very, very apprehensive about diffractive lenses, and therefore I don't know, I was very averse to it. So when refractive lenses came, and now that we say that types and types of new refractive lenses are coming up, and better refractive, and also they are correcting presbyopia quite well, up to N10, N14. So I am very apprehensive about diffractive lenses not having any of these problems that
So, sir, halos is one thing which is always there when there is a defocus. So if we are distributing light into 2 foci or 3 foci,
that is
but
not theoretically. When all your patients are happy, or all your
so that
patients,
is
They are
actually
happy.
that is the bottom line.
Yes,
If all your patients have to complain of no glare, no halos,
That is
and you don't have to spend chair time. I don't have to spend chair time on a impress lens, for instance, or saying any of these pure C lenses. But there's no chair time to be spent, because
Yes.
we know that there's going to be no problem. But any of the diffractive lenses, you have to caution the patient about halos and glares.
You must try this, sir.
Yeah, there's.
And whether he's driving in United States or whether he's driving in India. Because nobody seems to follow any rules for dipping their lights. Okay.
There is an
Thank you.
important announcement from the.
I think let's move on with the next speaker, in the interest of time.
Okay. There's an announcement from the organizers. The commercial names of medical devices, software equipment may appear in this content because they are linked to specific medical procedures which are the focus of this training material. Other products on the market can be used to perform the aforementioned medical procedures. The educational provider does not endorse any particular product. This is an
Okay,
alert
I
from the
hope,
organizers.
that is clear
So
for all
please use your caution accordingly.
Yes.